All right, hello everyone. My name is Dr. Joseph Benny, and I am a pediatric and family chiropractor here in Columbus, Ohio. Our practice is Atone Chiropractic, and today I'm going to be doing a video walkthrough of our Unraveling Neurodevelopmental Disorders workshop. Normally, we do this workshop about once a month in our practice, and it takes about 60 to 90 minutes to get through. I'm going to do a quick version. And so if I'm going faster than what you would like, or you would like to get more information, come to the workshop, or feel free to just call us and we'll be able to discuss more information with you one-on-one about how we might be able to help your child. But let me get going. So this is just a few slides on some stories we would like to share at the workshop. We'll go through those towards the end if we have time. Usually I have a video that is basically the message at the end. It says, it's easy to miss something you're not looking for. And so the main reason I have everybody watch that is because of that takeaway. So many times when it comes to neurodevelopmental disorders in our country, in our healthcare system in general, we're not asking the right questions. We're not looking for the right solutions. We're only trying to figure out the different diagnoses and coming up with different medications or drugs to treat the symptoms of these problems. We're not actually asking why they're happening in the first place. And so that's what doctors of chiropractic are all about. We are doctors of cause. And so through my training, one of my mentors, he's one of the biggest pediatric chiropractors in the country. And he always emphasizes, if you want to know what's going on with a child, ask the mom. And so moms, whether you know it or not, you likely have the answers as to why your child is struggling, or as to why your child is, not exactly as healthy as you would like. And so that's what we're going to go through next, okay, is the set of circumstances that when we ask moms what happened in their child's life, there's a few things that have come up time and time again, and that is what we see as the main causes that leads to the perfect storm, or leads to neurodevelopmental disorders, okay? And so that's the perfect storm. It's the concoction of all these different things that we've recognized over time that leads to a baby or a child growing with some sort of problem, behaviorally, emotionally, cognitively. And so what is the perfect storm? Well, after having so many conversations with parents, moms, 40 to 60% of cases that we see and that we care for, as well as all the other chiropractors that are trained in this same system, 40 to 60% see some sort of pregnancy stress or fertility struggle in the case history of the child, okay? So whether it was a child that was born or conceived via IVF or some other fertilization therapy, or they had a mom that was super stressed during her pregnancy, it's about 40 to 60% of cases. The next biggest one is actually the main one we emphasize all over the place in our practice. It's on our walls, on our posters. We tell parents, moms, that they definitely need to get their baby in after they're born to make sure that everything is okay, because birth trauma or some sort of intervention at birth or delivery is the next biggest thing that shows up when it comes to neurodevelopmental disorders, okay? It's not the next biggest thing, it's actually the most biggest thing. It's just the second one on the list here, because it's the second thing that happens in that order. And so 80 to 90% of case histories have some sort of intervention, whether it's a C-section, a vacuum extraction, a forceps delivery, or the doctor is simply just pulling on the baby's head and neck to get them out. Sometimes babies get stuck, okay? And I'm not pointing fingers, but that definitely happens, and so we need to get babies out, but that's not where we should stop as far as helping that child. If you need to pull on a baby's head and neck to get them out, that's gonna cause something in a negative way, okay? And so we need to help that child, not just leave them hanging, because that baby usually goes home, and now baby is just colicky. And they'll go, the pediatrician sometimes will be sought out, and the pediatrician's most common answer is, they'll grow out of it, don't worry. But if they don't necessarily grow out of colic, then they might start to have a lot of immune challenges, might have a lot of ear infections, and that's normal, they'll grow out of it. and maybe they don't grow out of it. Maybe they start to, have walking issues. They don't quite meet all their motor milestones. Maybe their gut issues start to show up. Constipation, reflux, eczema, allergies, asthma. Those are the things that can all manifest from a child that had some sort of birth intervention. So that's why we emphasize it in such a big way in our practice. Sometimes it doesn't manifest right away. Sometimes the child might seem like they're getting along okay, but then come around to the teenage years and they're anxious, angry, they're flustered, they have a lot of emotional distress. Depression and anxiety are on the rise, especially in teens. And then, it can also impact adults. When a child is stressed for their entire childhood, when they get to adulthood, they're not just all of a sudden going to be healthy. We say that sick kids grow into be sick adults and healthy kids grow to be healthy adults. And so if you're a sick kid, burnt out, stressed out, you're going to be the same way as an adult, anxious, maybe can't focus very well, ADHD, living on medications. And so we want to avoid all that at all costs, right? And so it all goes back to the story, the birth story, the stress that a mom experienced during her pregnancy. Maybe it was a stressor that the child experienced even after birth. Maybe they had a big fall. It doesn't always have to be those things, but that's what we dive deeper into at the workshop. But these are the things that we talk about as far as what can cause neurodevelopmental struggles. So the rest of this video, I'm going to talk about the science behind it and give you guys a little bit of a deeper dive into understanding how those stressors can lead to neurodevelopmental problems. This is a handout that we give every single new patient that comes into our practice, and you also get it if you come to the workshop. But what it's emphasizing up at the top, it talks about the 3 T's. Chiropractors classically, over the last 125 years, have been talking about the 3 T's: thoughts, traumas, and toxins. Okay, so thoughts would be emotional stress, traumas would be physical stress, and toxins would be chemical stress. So basically, the environment. Those are the 3 T's in one word, the environment. And so what those factors do, what the 3 T's do, is they really kick on our body's sympathetic nervous system, okay? And you can kind of see the little chart here, how it revs up from 0 to 10. It's kind of like a car analogy. You have a gas pedal and brake pedal in the middle of the slide there. And so what it's really describing is the nervous system. The nervous system is what we focus on, what chiropractors focus on day in and day out. We look and analyze and measure and test a person's nervous system, a child's nervous system, and we want to see what's going on. Because there's 2 modes to the nervous system. There's the sympathetic nervous system, the fight or flight response, and the parasympathetic nervous system, the rest and relaxation response, okay? And that's also where growth and healing and development happen, is that parasympathetic rest state. And so you can see if a child is stuck in stress, growth, healing, and development is going to be suppressed. You can't be in both modes at the same time. That's what it says down at the bottom there. You can't be in growth and protection at the same time. And so the gas pedal is that sympathetic nervous system state. And so the 3 T's activate the gas pedal: thoughts, traumas, and toxins. So if a mom was having a lot of emotional stress during her pregnancy, the baby was developing in that stress, so that's going to increase one of the T's for the baby. Baby maybe had a C-section. They were a C-section baby, and that increased their stress even more. And then they get into living life, and they start to have a little bit of an immune challenge here and there, and so they get some ear infections, and they get an antibiotic, and that shuts down their gut, so they start to have even more stress. And it just builds and builds and builds, and all the while, their parasympathetic nervous system is never really able to activate, and growth, healing, and development is not able to happen like it needs to. So that's what this chart shows, and that's how it applies to a baby, but it also applies to an adult. Say you're a healthy adult and you start to have a lot of emotional stress at work, financial stress at home, relationship stress at home, and physical stress. You start to, maybe you have a car accident or you slip on the ice. That's going to cause your nervous system to also go into more of a sympathetic state and shuts down your rest and relaxation state, and your body's ability to heal it is suppressed. And so down at the bottom of this chart, you can see all the different conditions, symptoms, diagnoses, whatever you want to call them, can start to show up. Okay, and so stress stuck on is what we're talking about with chiropractic and how it applies to neurodevelopmental issues. We have a word in chiropractic called subluxation, and subluxation is stress in the nervous system, and what it does is it keeps your nervous system stuck in that stress mode, okay? And so that's what you can think of for the rest of this presentation. Whenever I say subluxation, just say stress stuck on. The function of the nervous system is to perceive the environment and coordinate the behavior of all other cells. And so just real quick on that behavior, a lot of children with neurodevelopmental disorders have altered behavior, or they have very high energy, they're off the walls, they bang their head, they can't focus. Their behavior is not like the parents would like. And so rather than just try to punish their behavior or to change their behavior, we need to look back and say, okay, well, the reason they're behaving that way is because of their perception and the way that their nervous system is coordinating their behavior, okay? The function of the nervous system is to perceive the environment. So if they're not perceiving the environment accurately, if they're perceiving the environment as stress, then their behavior is simply going to be the coordination of that stress manifesting itself in how they're behaving, all right? And so if we can change their perception, change their nervous system's perception, and not have it be so stress dependent or stress loaded, and increase their rest and relaxation mode, then we can open up a window for them to be calm and relaxed, and allow for them to start to learn new skills and to develop emotionally and physically, and have their immune system and their behavior develop like we would like. So altered perception is also another way to understand what subluxation does. Subluxation and altered perception are synonymous, and what really is the result is the function is suppressed. Our bodies don't function like they need to when we have an altered perception. If we can't perceive our environment accurately, we're not going to respond accordingly. I'm not going to go too much deeper, but motor development is the first thing that has to happen, and so order when it comes to development matters most. So the motor system, movement, is what happens for a baby. They need to be able to turn their head side to side. They need to be able to stimulate that brainstem area with input, and that's going to stimulate the cerebellum, which is also going to then feed forward into the prefrontal cortex of the brain, and that's what is constantly happening when a baby is first born. They're constantly needing to be able to move and to observe the world around them. But if they have trauma in their upper neck and they can't turn their head side to side, or they can't latch and they can't focus on anything because they have tension up in their brainstem, that's going to hinder their development. That's going to hinder their brain development. And that's going to eventually lead to gut issues, immune system challenges, speech issues, social, behavior, emotional issues. Those are all the next steps in the progression of development. But it all starts with motor development, being able to move that upper neck. Not going to go into that or that. Real quick, a lot of times when people are hearing this information, they want to know, okay, so how long is it going to take to help my child? Well, the math equation of it is how much stress have they experienced? So that's what we ask about on the first consult. And then when did the stress occur? Did it happen early on in life, before they were even born? Were you stressed as a mother? What kind of stress did you experience? How much stress was there? And so the earlier that it happens and the earlier that we get them into our practice, the easier it is to help them. But that doesn't mean it's ever too late. It's never too late to change someone's nervous system function, to help the nervous system function better. It's simply just going to take more effort. So the earlier stress happened, the longer stress has been able to manifest, the more effort it's going to take. That's how we come up with care recommendations. That's part of the equation. I'm not going to go into that. Subluxation, like I said, just means stress stuck on. These next few slides describe a lot of the science of what we go through in the workshop. There's different factors of what subluxation does and the neurology of it. Dyskinesia is the first aspect, and so that's simply just a misalignment or a fixation in a joint in the spine. One of the bones in the spine, whether it's the brainstem, which is often what we see in babies, but it can be anywhere throughout the spine. It gets stuck and it doesn't move like it needs to. The next factor, I am going to show this video. So a lot of times people want to know, like, how does C-section impact a baby's brainstem? They're not, maybe you think it's not that bad. This is a video of a C-section, okay? And so this is a very casual C-section. The doctors are whistling, they're very calm, relaxed. They don't think anything's wrong, but just look at the amount of torque and tension that they put on this baby's brainstem.
Irritated. Oh, there you go, fella.
Come on, buddy.
All right. Ears of a girl. Ears of a girl. Make you cute for the camera.
Oh, yeah. Keep coming back and
There you go.
Makes me grimace every time I see a video like that. That's so much pressure and torque on a brainstem. And if you think about the upper neck, the bones of the upper neck, there's C2, which is shaped like a fist with a thumb up, okay? You have the vertebral body, and then you have a dens that comes up. And C1, the top bone of the neck, sits right on top of that bone. And so when they pull on a baby's head and neck, what it does is it tractions those two bones away from one another, and then they twist to get the baby out. And the spinal cord is right in between there. And so, you know, that's gonna cause a lot of damage and stress in that area where the brainstem sits. There's a picture. So again, it's easy to miss something you're not looking for, and so many babies are being born via C-section, even more so than is necessary. It's recommended that C-section rates across the country stay around 10 to 15%. They've been around 33, 34 for the last 10 years, and they've been way above 15% for the last 40 years. So way too many babies being born via C-section, as well as all the other interventions. And so there's just a lot of babies that are being exposed to these physical stressors, and no one is really aware of it, except chiropractors. Pediatric chiropractors are the ones trying to get this information out to more people. But you hearing this, you're of the minority if you know this information now. Here's the C-section rates, okay? So 33, I was at 2012, and it's been about the same for the last 10 years. How many babies have subluxation? Out of 100 infants, 99 in this study had some sort of subluxation in their upper neck brainstem. Here's some more studies. Dysappirritation, abnormal neural input. So after that dyskinesia happens, after that fixation and misalignment happens, dysappirritation is the next D that happens. There's 10 Ds that describe a subluxation. So dysappirritation is altered input from the body into the brain, okay? So if you think about a computer, if a computer is functioning properly, it's basically getting all the information that it needs. If there's ever a wire that is cut, it's not gonna get all the information that it needs in order to continue working properly. Our bodies are the same. Our brain is our processing center that needs to get all the information from the body. And when we have fixations and misalignments in our spine, that decreases the information from our body that is able to get to our brain. And so our brain is not getting good information. It's getting abnormal input. That's what dysappirritation is. I'm not gonna watch this video. Proprioception is just another way to understand that information that's going from our body to our brain. And so when we have dysappirritation, it's basically just altered proprioceptive input or decreased proprioceptive input into the brain. So when we have dysappirritation, our amygdala is actually hyperactivated. In our amygdala is a part of our brain it's our emotional seat of our brain, but it's also our fear center. And so if we have a lot of fixations or misalignments in our spine, and our spinal column is not able to move properly, and our input into our brain is not able to get there, our amygdala is going to activate, and that's our fear state, or our sympathetic nervous system state, okay? And so our bodies get locked into this fear amygdala type state, and that's where everything starts to get hardwired for stress. Our sympathetic nervous system starts to get overactivated. Hyperactivity of the amygdala associated with fear and anxiety, okay? I'm not gonna go too much into these. This is what we go through in detail at the workshop. Again, PFC is the prefrontal cortex. So if information is not functioning properly in the spinal column, the prefrontal cortex is going to be negatively altered. But what it's saying here is that when we improved motion and mobility of the joints in the spine, it improved vestibular and fine motor movement and input into the prefrontal cortex. So it improved activation or activity in the prefrontal cortex. The next D is dysautonomia, and so basically your autonomic nervous system can be understood as the sympathetic and the parasympathetic nervous system. Like I said, those two need to be, in balance of one another. We don't want the sympathetic mode stuck on, and so dysautonomia is basically describing that activation of the sympathetic nervous system. You can't be in growth mode and protection at the same time. Again, that chart. The vagus nerve is a big nerve that comes from the brain, and it goes down through the upper neck brainstem area and goes to the heart, the lungs, but also the entire digestive tract. So this is also often referred to as the gut-brain connection. There's that nerve is the brain's connection to the gut. And so if you have, again, misalignments in the upper neck brainstem area, it can interfere or irritate the vagus nerve or decrease the vagus nerve's function, and that's where the gut development can start to be altered or hindered. Dysponysis is basically just the manifestation of all of these issues in the muscles of the body. The muscles, the energy of the body starts to get dysregulated, and so children start to express a lot of hyperactivity, energy, raging bull, drunken bull. Those are the words that we use to describe it. They are all over the place. They can't sit still. They constantly fidget. They jump off the couch, the furniture. They hit stuff. They bang their head. That's Dysponysis manifesting in a child's behavior. This is actually what it looks like. One of the assessments that we do in our office can measure Dysponysis. It's an EMG assessment or electromyography assessment. And as you can see on the left here, this child has way too much energy. Green, blue, red bars are areas where the muscles are working way too hard or putting out way too much energy. We normally want every single bar to be white. So that's what this assessment allows us to show and to track. A few of the stories, I know it's already about that 22 minute mark, but a few of the stories just to give you an idea of how we've been able to help children in our practice. This is Jonah. He had a very traumatic birth. He was diagnosed right away with HIE or hypoxic ischemic encephalopathy. And basically his brain was without oxygen and blood for a long time, and they said that he was going to have some sort of trauma or stress. And so there's no other word to describe it other than subluxation. He was subluxated to the core right at birth. 15 to 20% of babies with this diagnosis don't survive. 25% of the remainder will have permanent brain damage. And HIE usually comes with lack of muscle tone, irritability, feeding problems, colic, sleep struggles, troubles grasping with their hands. Seizures start within the first few days of life. And so when Jonah came to us, he actually had a lot of these in play already. He came to us very, very early on, within the first 2 months of life. And after just a few months, he saw amazing changes, but we worked with him a lot. We had to get him out of that stuck state of stress. And so basically through chiropractic, we were able to help his brain and his body start to communicate better, and he was able to get back into that growth and development mode. So his mom had lots of great things to say, but basically he's back on track developmentally. He's walking, meeting all his milestones. He can even say Costco now. He's been coming to our practice for a little over a year now. He's about the same age as my daughter, and so they hang out all the time. But he's unstuck, his mom said, the last word there. Just an example of another one of our assessments that we use. This is a thermography assessment, so it actually shows us where there's irritation or dysautonomia in the spinal column. The red bars up at the top, the brainstem, you can see that's a sign of severe irritation of the nerves in the area, as well as down at the very bottom of the spine. The gut, that's also a major lower digestive tract control center. So the Sacrum S1 at the very bottom oftentimes is where we look to adjust if a baby's having issues, constipation or gas pain or bloating. They're very uncomfortable. This is a little bit older child. This is Paige. She came to us. You can screenshot this and read it, but she was having struggles with speech, energy levels, was very anxious, and she's also seen an immense amount of change, and her parents also are under care. Very, very happy, cool family. Andrew, 6 years old. His mom noticed improved focus, improved digestion, more regular bowel movements. He actually was on quite a few medications for constipation, gut issues, and so now he's able to not need those anymore. So that's pretty awesome. Not having to rely on chemicals early on in life is a huge win. But if you're watching this, the action steps I always have for any parent at the workshops is to keep asking questions, finding answers. That's usually what led people to the workshop or led you to this video. You're never gonna find all the answers. There's no secret ingredient. There's never a golden ticket to health. There's a lot of different things that add up over time, and that's what leads to health. But the way that you get there is not just by quitting. You got to keep working. You got to keep asking questions. So keep doing what you've been doing as parents, and you'll get the changes that you want for your family. The next thing would be to reduce and remove the 3 T's as much as possible. Get rid of as much chemical stress, physical stress, and emotional stress in your life, in your kid's life, and they'll be much better off for it. And the last thing is to get your child scanned. You may have already experienced stress. They may have already experienced stress, and their nervous system may be wired for stress. And so we can get them out of that. And once we do, then limiting those 3 T's will allow for them to just live a longer, healthier, happier life. And so getting scanned is step 1. We do 3 different assessments in our office. There's a heart rate variability assessment, a thermography assessment, and a surface electromyography assessment. And all 3 of those measure dysautonomia, dysponysis, dyskinesia. And so finding and identifying what your child is going through neurologically is what the scans allow us to do. And also understanding their story is that first visit. We do a consultation. We'll ask you about the 3 T's that your child has experienced or that you've experienced. We'll do the scans, show us objectively what we need to watch for to see change. And then we create a game plan for them, for you, and go through care. And we do reassessments throughout care to get changes made. But the first step to even knowing if we can help is to getting the assessments done, seeing what's going on in your child's nervous system. So that's all I have. I went a little bit longer than I expected, but it's hard to go through all that information in under 30 minutes, I guess. So thank you, and hopefully this was helpful for you. If you have any other questions specifically, we'd love to be able to talk to you. Just reach out, email us. Our website is atonechiropractic.com. You can find all the information that you need to connect with us on there. Have a great rest of your day.